Welcome to The Explainer. Today, we're breaking down what can feel like a huge decision for so many expectant parents, the epidural. We're going to cut through all the noise, get straight to the facts, and really help you feel empowered to make the best choice for you. So, let's start with a really powerful idea here. This whole conversation, it is not about strength versus weakness. It's not about a natural birth versus a medical one, not at all. It's about strategy. It's about energy management, and it's about your choice and how you decide to run your own personal marathon.
All right, so here's our roadmap for today. We're going to start by talking about choice, not shortcuts. Then we'll dive into how epidurals actually work. We'll walk through the procedure step by step, lay out the real pros and cons, bust some major myths, and finally, bring it all together so you can make your informed decision.
Okay, so let's really reframe this entire conversation. The goal here isn't just to grit your teeth and endure labor, right? It's about smartly managing your energy so that you have all the strength you need for the most important part, bringing your baby into the world. And this gets to the heart of what's called a realistic optimist approach. So, what does that actually mean? Well, it's pretty simple. It means acknowledging that, yeah, labor pain is real and it's intense. But it also means embracing the medical strategies that can help you stay an active, present participant in your own birth story, instead of just becoming a victim of the pain. All right, let's dive into the science of it. How does this thing actually work? I've got a really simple analogy that's going to make it all click. Okay, think of it this way. You know how things like deep breathing or massage can help? They work by kind of closing the gate to pain, giving your brain other things to focus on. But an epidural, it works on a whole different level. It's less like closing a gate and more like a Wi-Fi jammer for the pain signals coming from your uterus. It doesn't just distract from the signal, it completely blocks it from ever getting to your brain in the first place. So how does it jam this signal? Well, a tiny amount of a low-dose anesthetic gets delivered into what's called the epidural space. That's just an area right outside the protective membrane around your spinal cord. This is what blocks that really overwhelming, searing pain of contractions, but, and this is key, it still lets you feel pressure and even move your legs. The big benefit here is what doctors call physiological rest. It's a fancy term, but all it really means is that your body can finally truly rest and save up all that energy for when you'll need it most. Okay, I know this can be the part that feels a little scary for a lot of people. But knowing exactly what's going to happen can take that scary unknown and turn it into a totally predictable, manageable process. So let's just walk through it, step by step. So a board-certified anesthesiologist is going to follow a super precise 4-step process, and it's all designed for your safety and comfort. First, they'll start some IV fluids. That's just a little safety buffer for your blood pressure. Next, you'll get into position, curling up, arching your back, kind of like a shrimp. This just helps open up the spaces in your spine. Then comes a tiny sting, just a little numbing shot on your skin, before the specialized needle goes in to find the perfect spot. And then, this is the last step. A tiny, flexible little tube, a catheter, is threaded in and the needle comes all the way out. And I really want to pause on this because it's so important. This is what a lot of people worry about, right? But listen, there is no sharp, rigid needle left in your back. It's just a soft, flexible tube that stays in. That means you can move, you can shift, you can change positions in bed totally safely and comfortably. All right, to make a truly informed choice, you need the whole picture, right? The good and the not so good. So let's look at the real pros and cons, backed by data with total transparency. So let's just break this down. The biggest pro, obviously, is its incredible effectiveness for pain relief. Now, on the con side, yeah, there are a few things. A temporary drop in blood pressure can happen in about 10–15% of cases, but your team is watching for that and can fix it super fast. There's a very small, less than 1% chance of a specific kind of headache, and that's treatable too. And it is true, it might lengthen the pushing stage of labor a little bit. But let's focus on that first number for a second. 95%. That's the real headline here. Its reliability is just off the charts. We're talking about the single most effective form of pain relief available in modern medicine. And that effectiveness gives you the ability to rest, to talk with your partner, to just remain calm. All things that are absolutely vital for the marathon you're running. Now, let's contrast that with the risk of a significant side effect. That dural puncture headache we mentioned, the one caused by the needle going just a tiny bit too far, the chance of that happening is less than 1%. And even in that rare case, it's something that can be treated. Okay, and what about other potential side effects? Well, things like mild itching or a bit of nausea can happen, but they're generally considered more of a
nuisance than anything serious, and they usually fade. But I really want to address a major concern here, the idea that it leads to a C-section. The big studies are super clear on this. An epidural does not increase your risk of needing a C-section. It might, however, slightly increase the chance you'll need a little help from a vacuum or forceps during delivery.
Okay, now for the big one. Let's tackle the myths. The stories and fears that float around and create so much unnecessary anxiety around this whole decision. Let's start with the number one fear we hear all the time, that getting an epidural will cause permanent back pain. The medical fact, backed by huge studies, is crystal clear. Nope. Epidurals do not cause chronic, long-term back pain. When they look at women years later, there is zero difference in the rates of back pain between those who had an epidural and those who didn't.
So you might be asking, then what is causing that nagging backache after delivery? Well, the real culprits are usually things you might not even think of. It could be a deficiency in vitamin D or calcium, it could be from slouching while you're breastfeeding, or it could just be the lingering effects of that hormone relaxin, which made all your ligaments super soft for birth.
Okay, myth number 2. The drugs are going to make my baby groggy and they won't be able to breastfeed. Here's the deal. Unlike some IV painkillers that can make a baby a little sleepy, the medication from an epidural pretty much stays right there with you in the epidural space. The amount that actually reaches the baby is so tiny, it's negligible. And the data shows absolutely no difference in a baby's alertness or their ability to latch on and breastfeed right after birth.
So now that we've laid out the facts and busted the myths, it all comes back to you. The final decision is always yours, based on your body and your unique labor.
And even after the epidural is in and working, remember, you are a crucial part of your own care team. Yes, you're being constantly monitored, but you need to speak up right away if you feel any of these things: sudden nausea or dizziness, relief that feels like it's only working on one side, or any difficulty breathing. These are all things your team wants to know about immediately so they can make quick adjustments.
Here's a really practical piece of advice that doctors and nurses often give. It's called the 7 out of 10 rule. Basically, if your pain hits a 7 out of 10 and you find you just can't focus on your breathing anymore, don't wait until you're completely exhausted to ask for help. That's the perfect time to have the conversation. Getting an epidural at, say, 4 or 5 centimeters dilated can be an absolute game changer, saving all that precious energy for pushing.
Because at the end of the day, that's what this is all about. It's about saving your strength, both physical and emotional, for the grand finale, for that final, critical stage of birth. The best choice is simply the one that allows you to arrive at that moment feeling capable, present, and strong.
So the goal isn't just to endure, it's to be empowered. Empowered by information and empowered by choice. So now that you have the information, how will you choose to run your marathon? We hope this has helped you feel ready to have that crucial conversation with your doctor.